Hi everyone. During our most recent leadership meeting, we realized that there is a disconnect as far as the information that everybody knows about Invisalign, about our payment options, about kind of what the process is like for the patients. So I wanted to help kind of close that gap so that we're all on the same page. If you don't know anything about Invisalign, stay tuned to the end of this video because I'm going to kind of give you a brief rundown of how to explain it to patients and kind of what the best benefits are to make sure to go over and a little bit about the process. But what I think is good for everyone to know and information I know not everybody has, I'm going to start off with resources that you have to be able to go over Invisalign with patients. So first, I want to show you two things. One, Dr. Cologne, zap to him, ordered these amazing brochures that we got from Invisalign. We have them in both English and in Spanish. And then if you look on the inside of these brochures, it doesn't just talk about Invisalign and the process, but it talks about the systemic connection between periodontal disease and having aligned teeth and all of the gritty details that go into it, but in a really easy, fun way for patients to get that education. So if somebody's interested in Invisalign, specifically someone who has gingivitis or periodontal disease, which we know is a big group of the population, they would be a really great candidate to have this brochure to take home just to have some additional information. Another thing is we do have models in the office that show you kind of what an arch would look like with the aligners able to be taken on and off. For those of you who are familiar with Invisalign already, these models do include attachments, so that way you can kind of give the patient an idea of what to expect as far as size, and obviously everybody's are different, location is different, but just so that way you can give them a pretty good example of what to expect when it comes to attachments. One other thing I wanted to be sure to review with everyone is our different payment options. So with Invisalign, we are doing something a little different than when we were previously doing Invisalign here in the office. One of the main differences is that we're actually allowing an in-house financing option in addition to just care credit. So this is what our Invisalign treatment plans look like. If you are given an Invisalign treatment plan that looks like our standard one, give it back to the front desk or give it back to the treatment coordinators and be sure to request that it come to you looking like this. The main difference, if you look closely, is that it's going to have their total treatment, including the retainers, if you're including the retainers in the treatment or not. And then also we'll go over the different payment options. So one thing I want to be sure to point out to you is unless the doctors specify otherwise, we're defaulting to removable upper and lower retainers. When they get to the end of the treatment, the doctors can choose to offer them those fixed retainers, but they would still need the removable ones either way. So we want to be sure to build that in the beginning so it's not a surprise to the patient at the end of their treatment. One other thing that I wanted to be sure to point out to you, so you're going to see the total estimated insurance. Invisalign is actually the only service that we do in our office that our no bill policy does not apply to. Basically meaning that if a patient is planning to use $1,000 of their insurance benefits for their orthodontic maximum, and then they cancel their policy before all of those payments are paid out, the patient is going to be responsible for that difference. It's not a huge thing that you need to go over with patients, but just in the case that that situation happens, just so we're all on the same page, that would be a case where the patient's responsible for paying it back. So if someone's about to leave their job or about to lose their benefits, trying to maximize what they can get from the insurance isn't always going to be the best bet, because usually insurances pay Invisalign and just braces in general in quarterly payments. So it would be a case where we would only get like a quarter of the payment, not necessarily their full maximum. If you have any extra questions about that, feel free to get with me, but I just wanted to kind of give you a little summary when it comes to the finance part. As far as payment options go, we do offer 24 months no interest. So you can go up to 24 months no interest. It's this first payment option here is it'll show you that we have the no interest option through care credit, 12 to 24 months no interest. And be sure to fill out those sections to let them know what those monthly payments would look like and make sure that it's comfortable for their budget. As we all know, in the case that those payments are not comfortable for their budget with care credit, the interest rate does go up to 27% after that promotional period. So be sure to review that payment and make sure it's comfortable for our patients. The next one that you're going to see on this form is our in-house financing option. So most Invisalign cases are going to range anywhere from like $3,000 to $5,500 that the patients are going to be responsible for. So you'll see that the down payment for that in-house financing option, down payment is $2,000, and the remaining amount of the balance is broken up over 6 months. That'll be set up with a credit card authorization. We'll actually remove that amount from their account on a certain day of the month, and we'll do that for the 6 months automatically. So they don't need to come into the office to make those payments. And then the very last one is prepayment in full. So if they decide to go ahead and prepay for the treatment, when they're starting the case, they'll get that additional 5% off. So you'll be able to show them here what that additional discount will end up looking like. By the end of it, whether they choose to accept the treatment or not, still have them go ahead and sign and date at the bottom, and then we'll scan in a copy, and then they can take a copy home. Just in the case that later on they have questions, we can always send it over to them, or if they call in, we have the same thing in front of us here that they have in front of them at home. So if you are familiar with the process of Invisalign, you can go ahead and cut off here. But for everybody else who's new to Invisalign, I just want to give you a little bit of information about kind of what that process is going to be like in our office. So first off, that very first appointment, we are offering no charge consultations for our patients to come in and just get information about Invisalign and fill in any gaps of, you know, what they think Invisalign is going to be like and what the process will really be like for them. So at that consultation, we'll be able to go over all this information with them. But one of the things I want to show you when you look at these little models here is that when the patients get their trays, they're going to get an upper and lower tray as they go through the process. And then when we receive their case, we actually receive their full sets of trays. So we give them a couple every appointment, but they're going to have an upper and lower tray that they're going to change out every 2 weeks. So every 2 weeks, they're going to put in a new upper and lower tray. What Invisalign does is it does those movements slowly over time, just moving a little one tooth at a time or just minimal movements every 2 weeks. But over time, they end up getting that smile that they're wanting, but they're able to do it without the inconvenience of regular standard braces. One of the perks to Invisalign is that you're able to remove them and you can clean your teeth really thoroughly. So patients who have gingivitis and periodontal disease, they are better candidates for Invisalign than standard braces because they can't remove the braces to be able to floss and clean their teeth, you know, the way that they're accustomed to. So with Invisalign, they're able to be super thorough with their home care. The other thing is say you have a big event, you're going to, you know, a wedding that's only going to be a couple hours and you want to be able to have your normal smile. The cool part about Invisalign is that if you choose not to wear your aligners for that event, you still are going to have the smile that you're accustomed to. Now, even with the Invisalign aligners in, it's really hard to see. It just kind of looks like you're wearing a clear retainer. In pictures, specifically pictures that are far away, it really is invisible. You can't really see it. I personally went through Invisalign probably back in 2012. I'll tell you, for the first couple of weeks, something to kind of give patients a heads up. It can give you maybe like a little bit of a lisp or impair your speech just a little bit. You get used to it and you become accustomed to it and start talking normally after a couple weeks at the most. And one of the other things that people usually don't think of in advance is, like I was mentioning before, those attachments. Basically, so that we can get the teeth to move as quickly as possible, they place what's called attachments on the teeth, also referred to in our office as buttons. But you'll be able to see if you look really closely on this one tooth. I don't know if it'll let you see. If I tilt it this way, you can see it a little bit. So see that little notch there on the tooth? That's what's called an attachment. So at certain appointments, the assistants might ask you to reserve additional time because the attachments need to be changed. Basically, they're having to trade in and out those little plastic pieces, but it's definitely something that, you know, takes extra time rather than just giving the patients additional trays. The first appointment for patients, just so you have an idea, that data capture, that appointment generally is going to be around like an hour and a half. So not the consultation, but the actual start of the case. It'll be about an hour and a half, and it's going to be taking molds of their teeth. It's going to be measuring spaces. It's going to be the doctors planning how they want that end of the case to look like. So be sure we're allowing enough time for them to get those cases started. As far as things that can happen with Invisalign, sometimes it does cause dry mouth, having that plastic in your mouth. They're going to be really great candidates for Prevident, specifically the dry mouth Prevident, because they may experience dry mouth while they're in treatment. It won't be something that lasts after treatment is over, though. Last thing to know about Invisalign is that every case is going to be different. So there's no way to know how many aligners someone is going to need when they start their treatment. But the key to keeping somebody on track with their case and to get the treatment done as quickly as possible, which I know is going to be everybody's goal, is going to be to make sure that they're keeping those regular appointments. So if the doctor gives them one tray, they need to schedule to come in exactly 2 weeks. If the doctor gives them 3 trays, because it's every 2 weeks they're going to be trading them out. They need to come back into the office exactly 6 weeks. So keeping up with our patients and making sure they're keeping those appointments will keep the treatment times down, which is going to be best for the patients and even best for the practice too. If you have any additional questions about Invisalign, you can get with one of our doctors. They may be able to answer any additional clinical questions. Myself, Kristen, I think are the team member. Dr. Lopez actually had Invisalign. Myself, Kristen, and Dr. Lopez would probably be people who you could ask if you have questions about what the process was like on the patient side. Any questions that you have about financing or resources for the patient, just be sure to get with me and I'm happy to fill in those gaps. Thank you so much for taking the time to watch this video, and I will see you around.